Senators, I have received the following letter from Senator Moore. Dear Mr President, pursuant to Standing Order 75, I propose that the following matter of public importance be submitted to the Senate for discussion. The Abbott government's radical plan to scrap all Commonwealth funding for public hospitals. Is the proposal supported? The proposal is indeed supported, and I understand that informal speaking arrangements have been made in relation to today's debate. So with the concurrence of the Senate, I will ask the clerks to set the clock accordingly. And I call Senator Lyons.
Thank you, Mr President. And yesterday we found, along with this proposed radical new plan for our public schools, which will see public schools become ghettos if it sees the light of day, we now find out that the Abbott government wants to scrap Commonwealth funding for public hospitals. That's what leaked documents tell us. And what I can say today with absolute certainty in this place is that when it comes to health, and in particular public health, Liberal governments, whether they are state governments or whether they are Commonwealth governments, simply cannot be trusted with our health. They have an appalling record. And we all remember when Mr Abbott stood there before the election and said there would be no cuts to health. Well, what an absolute mistruth, broken promise that's been, because we have seen agency after agency scrapped. We've seen good programs lose their funding, and it would seem that there is no end in sight with this latest leaked proposal to scrap Commonwealth funding to our public hospitals. I don't know where the Abbott government thinks the states would get funding from to fund public hospitals. They must think just these funds are going to fall from the sky. But let's have a look at what they've done to health in the very short time that they've been the government of Australia. The GP tax, the rumours around that, and we had versions 1 and then versions 2, and we've now got version 3 by stealth. So we have already seen in this country the Abbott government impose a tax on people when they go to the doctor. We saw and we've seen the closing of Medicare locals. What a huge success story they were. But no, they were put there by a Labor government, so that's enough for the Abbott government to say they have to go. We've seen the largest increase to private health insurance premiums in a decade, and just with the stroke of a pen they were able to go out. We've seen our medicines, the price of our pharmaceuticals will go up. We've seen cuts to preventative health research. We've seen cuts to chronic disease prevention. We've seen cuts to rural outreach. And on top of this, what we saw yesterday in that leaked document was it's the Abbott government's intention to go even further and to scrap Commonwealth funding to public hospitals. And I'm sure you'll hear them get up there today and deny that. Well, that's the pattern of the Abbott government. First you leak the proposal, then you deny it like crazy, and then maybe you tweak it a little bit and in it comes. That is their record on health. And let me just look at Western Australia. Fancy asking a state government that has had its credit rating reduced to pick up any funding for public health. What kind of a game is that? And the people that will be worse off are Western Australians, because the Western Australian government has shown itself to be absolutely incapable of running a public health system, in the same way that the Abbott government has shown itself to be incapable of running and funding proper health services in this country, good preventative health services. The West Australian government is well and truly up there in terms of simply not being anywhere confident in running public health. We will have the projected mid-year deficit in Western Australia is $1.3 billion. $1.3 billion. But does the Abbott government care? No. It's going to try and foist the cost of running public hospitals in my home state onto a government that's got no money at all because of its absolute mismanagement. And that deficit in Western Australia is projected to blow out to $2.7 billion. And they can't run a hospital. We've seen Debacle after debacle with Fiona Stanley, a flagship hospital developed by the previous Labor government and paid for. First of all, what the Barnett Liberal government did was privatise that hospital to a company that runs prisons and detention centres. So we have our flagship hospital in Western Australia, a 20-year contract with Serco, a 20-year contract, never run a public hospital in this country before, but that doesn't stop the Liberals. No, 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 they give it away. And we've seen debacle after debacle. 18 months over its due opening date. Almost $500,000 a day in debt in the cost overruns in that hospital. An IT system that was so inadequate the state had to take it back. Goodness knows what the cost of that is. And more recently, in the last 4 to 6 weeks, sterilisation, an absolutely integral part of a public hospital, keeping patients well, giving them good surgical outcomes. Debacle after debacle, instruments going up to theatre all bloodied, instruments going up to theatre with bits of bone on them. So bad it was, despite the state health minister, the Liberal state health minister saying, oh, nothing wrong here, finally concedes. So Serco have lost that contract. So they lost 2 contracts in the very short space of time they've had that hospital. First the IT system and now the sterilisation. And this Abbott government wants to hand the funding of public hospitals over to the West Australian government. What a joke. Neither the federal Liberal government nor the state Liberal government can run hospitals. And it doesn't stop there in Western Australia. In 2008, it was proposed the Royal Perth Hospital would close, and it would close because Labor had a flagship hospital, Fiona Stanley, which the Liberals have since dragged through the mud. But no, the Barnett Liberal government made a great promise to the people of Western Australia that they would turn Royal Perth Hospital into a 400-bed emergency-type hospital. Well, guess what? That's not happening anymore. Completely scrapped last year, a broken promise there. And our rural hospitals, great plans to upgrade them, but guess what? They've been scrapped as well. So we've seen in Western Australia public hospital after public hospital absolutely lose funding. And the latest Barnett debacle, they give eastern suburbs, a poor area, they give the public hospital there to the Catholics, to the St John of God healthcare system. So guess what happens to reproductive technology? It's gone. Absolutely gone. Oops, said Mr Barnett. We didn't realise that St John of God's wouldn't do any reproductive health. They won't do terminations. They won't do sterilisations. No, no, no. So Mr Barnett says, it's all right, we'll build a standalone facility in the grounds of this privatised hospital. And St John said to them, oh no, you won't. We're not having those services next to our hospital. So what a bungle by the Liberal state government. And this is exactly what this government is trying to do. And it doesn't matter how much they stand up in here and say they haven't cut the health budget here, the federal health budget, they absolutely have. And what a low blow yesterday. Your leaked document, the leaked document which says they're trying to get out of funding, Commonwealth funding of public hospitals. Well, the health status of Western Australians is already in a parlous state because of the constant bungling, the cost overruns of the Barnett government. Goodness knows what will happen to Western Australians if this latest move comes into being, and that is the record of the Abbott government. Deny, deny, deny. Remember the GP tax? Oh, we're not going to do that. Deny, 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 and suddenly there it is, a GP tax, and that's exactly what will happen here. And I'm telling you, Australians will not stand for it. Our public hospitals, our public health systems used to be world leaders, and under this Abbott government they are slowly and surely being dragged down to levels that are completely unacceptable in a country as wealthy as ours. Preventative health, we've heard frontline service after frontline service lose money under this government. Drug and alcohol services, we hear so much about their ICE program. Well, it needs to be a preventative focus, and the Abbott government don't seem to understand that as they rip frontline funding away from services like that. And we've seen them deny this, and they'll continue to deny it, but the truth gets out. And this is a disgraceful move, particularly from a government who stood there and said in the lead-up to the election there'll be no cuts to health. And that's completely untrue. We've seen nothing but attack after attack after attack on good preventative services, and this latest disgraceful move to scrap funding to our public hospitals.
Thank you, Senator Lyons. Senator Nash.